Can you see my screen now, Jenny?
No, not yet, but I will put it on in a moment. Good
Okay.
afternoon, everybody, and welcome to our webinar today. Thank you all for joining us in your lunch break. Sorry, I'm just trying to bring up my flyer. Before I go any further, my name's Jenny Pearson. I'm an Education Officer for the Primary Health Network, and welcome to our Preventing Suicide, a SafeSide Lunch and Learn for primary care providers. I'd just like to acknowledge the traditional custodians of the land that we're meeting on today and pay respect to elders past, present and emerging. I am coming you from Anawan land in northern New South Wales. Today we have a presenter for you from SafeSide. Her name is Anne Wood. But first of all, we're going to hear from our Commissioning Coordinator for Mental Health and Suicide Prevention, Francesca Groves. Thanks, Fran.
Thanks, Jenny, and hi, everyone. My name's Fran, and like Jenny said, I'm a Commissioning Coordinator at the Primary Health Network. I too just want to start by acknowledging the traditional custodians of the land that I'm meeting on today, the Wanneroo people here, and the Seneca people of Western New York, where Anne's coming from, and just paying my respects to elders past, present, and emerging. I also just wanted to talk about self-care before beginning today's webinar as well. If you're feeling distressed by any of the content or need to take a moment offline, whether that's on mute or just stepping away for briefly, please do know that help seeking is available. Mind Health is a PHN funded low intensity counselling service available online or via phone for anyone living or working in Hunter, New England or Central Coast. And Lifeline can also be reached on 13 11 14. Just to sort of give you an overview a little bit what the PHN is doing and why we've partnered with SafeSide. So reducing suicide deaths in our region is something we're all passionate about, but having the right tools and training to do so is often a crucial step. Over the last year, the PHN has worked closely with both Hunter New England and Central Coast LHDs to build a consistent approach towards reducing suicides through the implementation of SafeSide training across their workforce. To make it really clear, we've got an offering today, which is now on your screen. So we've got the opportunity for 40 practices across Hunter, New England, or the Central Coast to embed SafeSide into their workforce. There's no financial commitment required from you to actually get started and implement. So we're actually offering this as funding. And what it is a subscription to SafeSide training. So it's access to online resources, support, and access to community forums. Now I'd just like to pass over to Anne Wood, who will introduce herself and kick off today's webinar.
Good day, everyone. I'm Anne Wood. I'm the Vice President of Subscriber Success for SafeSide Prevention. SafeSide offers suicide prevention workforce education. Our program was designed and developed by Dr. Pisani with the assistance of Christine Mossgraber and other people of lived experience. Everything we do is done with that voice in mind. We're going to talk a little bit today about the program, and I'm wondering if you might pop into the chat for us a few things that you would like to take away from the session today. If you have any question, Fran could then let me know what those are. We'll make sure that we've covered them in the half hour that we'll spend together. During our time together today, we'll speak briefly about suicide prevention in healthcare, SafeSide's education model, which we refer to as in-place learning, the SafeSide Framework, and the next steps for evaluating the SafeSide program within your organization. Please feel free to ask questions at any time and stop us for an answer during this event. Suicide prevention across the healthcare systems has three basic pillars: the culture of safety, practices and policies, and the workforce development component, which is what we'll be speaking about today, the education that is required for workforce as they begin their journey within an organization and as they continue their tenure with your organization. So the SafeSide program is actually underneath the workshop or workforce development component. You'll notice lived experience is a component of everything that we do across the work that we do with our partners. SafeSide was founded by Dr. Pisani to solve a problem. The challenge that Dr. Pisani saw in the environment came through experience and his own loss. And so he set out on a course to engage and unite workforces, diverse workforces across diverse location and population with a common set of practices and tools to address the issue of suicide. Out of Dr. Pisani's work, he developed an approach, which is the foundation of SafeSide prevention. He first developed a framework for recovery-oriented suicide prevention, and then also out of the work that he was doing, developed a protocol or an approach to delivering that information, which we call in-place learning. The framework actually consists of 4 pillars: connect, assess, respond, and extend. I'll touch on these very briefly, given the short amount of time we have together today. We can also share information after the session to give you a taste of the video-based learning materials that are part of this program. Connect is all about asking, collaborating, and committing with a person. Asking, the workshop material focuses on having staff learn how to directly use standard items, terms, ask about the person's experience, and collaborate with them around a goal of feeling better. Also, seeking to gain a commitment to recovery, whatever recovery means for that individual. Assess, in the primary care program that we're discussing today, is touched on a little briefer than it is done for others in the clinical health or clinical service, but we still in primary care talk about understanding the purpose of assessment, using a structured approach. We identify foreseeable changes and available resources to assist with planning. And then, of course, we talk about how all team members can contribute and how to facilitate efficient communication across the care spectrum. And I see Fran, so maybe someone has a question. No? Okay. In the Respond module of the program, we talk about how to increase contact as a possible solution or tactic to use when working with an individual. We talk about referrals for unmet needs and contingency plans. And then in the 4th element of the framework, extend is the extend portion of the framework. We talk about carrying contacts, how to get input, share plans, define clear roles, and then also structured follow-up, carrying contacts, and warm handovers are very important. And that is the extend module. That's a very brief overview of what the framework is and the core elements of it. The framework itself is taught through a workforce education model that Dr. Pisani developed, working with several other people at the University of Rochester, Dr. Cross. But what they came across in their experience is that online learning or expert workshops or train the trainer programs really were not delivering expert instruction to the level of fidelity that was required. Also, Group interaction was found to be one of the ways that learning is transferred and that learning happens. Group interaction and experience builds a bond with the people in an organization. And then, of course, the ability to sustain and transfer learning as your workforce changes and grows. The other important thing about an in-place workshop model was that the local leadership or local management teams felt ownership and responsibility. This isn't sending someone off to do a one-day training and come back. This is actually something that can be done ongoing inside your own organization. It also does not require any special train-the-trainer. So what Dr. Pisani decided was that to teach the SafeSide Framework, he would do it using video-based educational materials that then asked the learners or the participants to break into small group sessions and frequent sessions during the course of the training program, so that they could learn from each other's experience, learn from the materials that were presented, and also have the opportunity to bring in examples from their own day-to-day work and the culture. So in-place learning is comprised of 3 components: video-guided workshops that are done together in small groups, monthly office hours in a community of practice that allow for participants to continue the learning journey once the workshop is finished. Monthly office hours are hosted by Dr. Pisani and other staff of SafeSide. Updates and refreshers are available on an ongoing basis in the participants, with the participant subscription that's part of the program. Every participant ends up with an account to log in and utilize the materials at their convenience. Video guided workshops are actually designed with the voice of lived experience. There are demonstrations that involve patient actors and clinicians. Then the settings that are, we purposefully try to not make these things too realistic, but they are scenarios that are used throughout the training to exercise the framework. They are done in pairs or small groups. The video does everything for the host. The host really plays the video and facilitates the conversations, brings the group back together to keep them on track. But the everything else is actually driven through the educational material. Part of the subscription services are monthly office hours. These are half-hour sessions offered twice a month in different time zones for people to come and ask questions and have the opportunity to network with other people who are implementing the program. It's a great professional networking opportunity as well. The community of practice is online, and so it's a closed network for people who are part of the SafeSide program. In-place workshops where the video guided training happens are actually done in they can be done in 3 one-hour sessions, or you can break them up in smaller chunks for people to experience it, but they are 3 hours, 50-minute modules. There's a pre-evaluation at the beginning and a post-evaluation at the end. The evaluation data and completion information is available to project leaders in their SafeSide account. Hosting a session is the first thing that needs to be determined, who will host and when, but it's simple. So you you plan. The host watches a video that's about 9 minutes that explains what their role is. And then, of course, you can walk through the steps of the evaluation. So in planning, you decide how many sessions, whether you'll do it in person or remotely, schedule the session, and then invite the participants to attend. We're asking for them to bring device because, of course, the pre-evaluation and post-evaluation are best when they're done during the training. The host tasks are simple. We've tried to streamline it. So all participant materials, the workbook is electronic. The host can distribute it prior to the event, or if you're in person, maybe you would hand that out. Testing the technology, everyone is used to these online calls. So if you're online, it's as simple as the session that we're having today. And in person, you know, in conference room, maybe you need assistance, but the workshop is easy to host, and we do encourage everyone to, the host to try and get everyone to participate. Sometimes that's easier, and people talk too long. That's one of the caveats I guess I should bring up. The sessions are 1 hour each, but depending on how long the discussions go, it can extend the time, and many people feel the conversation so rich they let the time run longer, but that's truly up to the organization and the host. Evaluation is part of the program, and a few of the constructs that we're measuring are showing on the screen, but it is included with the program. The completion reporting, so who has taken the pre and post evaluation, is available to the project team. And the evaluation actually is the key to unlock the participant's SafeSide account. So once they take that post evaluation, the training material, and all of the other resources that are in the portal is available to them. So a participant takes the workshop, they complete an evaluation, they then have can download their completion certificate from their account, and the account and community of practice are available to them. And so in summary, we have a 3-hour video-based workshop done in small groups, monthly office hours. It's great for new employees and trainees who can come in and get reinforcement for the work they're doing in office hours. And then updates and refreshers. In the portal, there are a lot of tools and templates available for people who are implementing this program. Also, community of practice where questions can be answered or asked of others. And that is the highest possible level of the program. And I'm wondering if there's any questions anybody might have at this time. Fran or Jenny?
There has just been one pop up actually. Is this something we can pass onto the patient or just for staff, is the question we've received.
That's a great question. This training is delivered to staff. However, the framework or filling out the safety planning sheets or the framework document itself is often used as a tool when someone is speaking to a person. So yeah, the training specifically is for staff.
Any other questions? Like Anne said, this is at a very high level, so we understand if it's a lot to take in 20 minutes, but it's that we had to fit it in within 30, allowing some time for questions, and I suppose just reiterating what the PHN's offer is. So, you know, Anne has covered how this fits within the framework, but from the PHN side, this is actually our focus now is working with the primary care providers in this primary care space to actually link in with what our LHDs are doing. So this is already being, you know, SafeSide is being run through both of our region's LHDs through the staff there. And I guess that's where we're trying to make this common link and bridge together consistent language and also a consistent approach, because we know suicide prevention is, you know, is bigger than just one person. It's bigger than just one organization. It takes, you know, really the whole healthcare system to provide that wraparound service to people. So this is just one small way. This is just workplace training implemented over a series of years, it can be, and that's, I guess, what the PHN's offer is at the moment. We can provide this subscription to that access, like Anne said, to refreshers and updates. It's not just a one-off. There are many different modules, and you can attend those monthly office hours, connect with people who may be having similar challenges, or, you know, you might just have a question for someone else and they've already experienced it, so it can provide you some answers back. I know that Dr. Tony Pisani is often in there and he's posting about what research he's working on. So there's all different ways of connecting in and asking questions and getting support, and the SafeSide team really work with you to implement this. So don't, you know, it's never just we sign you up and subscribe you to this and then you're left to your own devices to implement. There are a whole wraparound service and many others in the SafeSide team who actually work with you. There's a whole series of templates and resources around communications and emails to your team, and just setting you up for, I guess, the best way forward to actually implementing this correctly and making sure your host feels comfortable rolling this out.
Yeah, that's a great point, Fran. We do, if you decided to subscribe or participate in the program, we do help you kick off the program, and then we do have check-in or consult visits with you during the course of your implementation to review your evaluation outcomes, talk to you about some of the changes you might be experiencing in your implementation, policy, practices, procedures.
So if there's not any more questions, I suppose just looking at some of the next steps, like we said, this is a lot of information to take on board. If you are someone that sits within a primary care practice or an organisation that does have a focus on mental health or suicide prevention, we will circulate some really concise links with some videos and some resources and some information on what SafeSide is and the offering that the PHN is doing for practices within Hunter, New England or Central Coast. And what you can do with that information is take it to your decision makers, whether that is your practice manager, whether that is yourself joining today, whoever that is that you may need to make some more decisions around, you know, uptake of this offer. So we'll circulate that in, you know, either tomorrow or early next week, so that you've got some more information about what it is we're offering. You can get some more information and watch some of the videos. And yeah, just to reiterate, there is no financial commitment. This is funded by the PHN to support primary care practices in our region for a period of 2 years. And we're really here to support you every step of the way.
Thanks so much, ladies. I think Fran is going to send out all the participants some resources. So just keep an eye out for that email. And Anne, thank you so much. And we'll catch you all next time. Goodbye.
Thank you.